Hi, I'm Rob McIsaac. I'm here in the ICU at the Juravinsky, and I'm here with...
I'm Josh Orzel. I'm one of the registered nurses in the ICU at the Juravinsky, and welcome to Critical Care. So this room specifically, this is our cardiac arrest room. So anytime there's somebody in the hospital that needs a really high-level critical care, right now this is where we bring them. If there's a code blue in the hospital, if there's somebody that the race team sees that's just not doing well and needs higher level care than what they can provide on the ward, generally speaking, this is where we bring them. So race team is a new thing at our site. The General's had it for about 8 years now. And basically what it is a team that sees patients in the hospital that have either left ICU, have been referred by a physician or a nurse or somebody on the floor that's worried about them. And we go up and see them just to bring critical care to them.
So it kind of expands the coverage of the ICU to the whole hospital.
It does, and it really affects, we don't have patients coming down in a code blue situation that weren't able to be cared for on the floor prior, because this team can go and see them and hopefully prevent them from coming to the unit.
So it seems like there's a high level of capital intensity for all of these, for this unit and for this room. Maybe you could tell me about these machines.
Yeah, so this is our servo-I ventilator, and basically this is somebody's lungs. When they're not able to breathe for them, we use the machine to do that.
And so what do you do to stay current? Because the technology
Lots
changes.
of education. Things change all the time. We have people in here, I'd say nearly on a weekly basis, just training us on different new products and then staying up to date with all your certifications every year.
Wow.
So rounds happen twice a day, in the morning and the evening, on the day shift, on the night shift. Rounds are how we decide this is what we're going to do for the patient, this is what we're going to test for, this is what we're going to treat, and how we progress from them being admitted to ICU to going back to the floor.
So the purpose is to get a multi-disciplinary look at every patient, and bring all kinds of different lenses to it, and then work together as a team to make sure we're doing what we should be doing.
Right, and without rounds, a patient doesn't get looked after.
What is it about the job that you like? Relate what you're doing here to what really gets you going in the morning.
It's coming into work and not knowing what's going to happen. That's the best part about working in ICU and working on race, and is coming into work and knowing that you're going to help somebody today. You don't know where, when, or why, but you know you're going to help somebody today. And that's the best part for me about working in ICU.
I think Josh and the whole team in the ICU really embody so many of the strategic goals that we've set for ourselves as a hospital. They are completely dedicated to providing quality care, which is so important for patients as sick as the patients that we see in our ICU. But they're also thinking about the patient experience and bringing families into the equation, treating not just the patient but also the families, understanding that that's a journey that everybody takes together. There are also people who are dedicated to improving themselves and taking advantage of development opportunities. So it's a great example of what we're trying to achieve here at Hamilton Health Sciences, and totally impressive. So that's it for this time. Thanks very much.